Okay, my name is Ms Ling Ying Sia. I am 39 years old. I've been trying to conceive. We're married, has been married for the past 4 years. So we have been trying to conceive for the past. Actually, we have did 3 times. This is the third attempt for our IVF.
Can you share a little about your IVF before TCM?
Okay, before TCM, that means so the last two IVF that I did wasn't in here in DC Mall. It's in another center. That time someone has told me regarding acupuncture, but I wasn't really compliant to it. So this year the difference in terms of the journey is that we tried in another center at Fertility, and it's good that it's strategic that Fertility is just beside Fertility. And then the way they advertise about the fertility acupuncture, because the initial 2 years it was like I didn't really know about acupuncture. It's just like just any acupuncture. So then I got to know about this fertility acupuncture. And I can see when I went into the fertility, there's a lot of cards there. So I was like, which one should I choose? And then I saw Ms Ling. I don't know, based on the qualification, she looks like very qualified, and then she has some obstetric or gynecology, some diploma or something, and
Degree.
degree in that. So
Master.
master in that. So I was like, okay, I wanna. I mean, I took Miss Ling as one of my as my this one acupuncturist, and the good thing I like about fertility is that it's the same person who's gonna do my acupuncture all the time. And other than my fertility specialist, I think Miss Ling also knows about my journey very detailed, because I've been seeing her like more frequent than I see my ONG and my fertility specialist, because the acupuncture is before the oocyte pickup, OPU, is like very frequent. And then you have to take the herbs and you have to do twice a week. So and it's not like a burden to me, because I feel you go for your TCE at the same time you go for your acupuncture. So it's very convenient for me. That's why I really like fertility. I mean, it's very one to one. I mean, it's very personalized. Yep.
Do you mind sharing about your emotion after the failed transfer previously?
Okay. Of course, if you ask anybody who's in this TTC journey, because my issue is actually having a blockage. My tube was blocked. So, as someone in medical profession, in my mind, it's like if your tube is blocked, so when you do IVF, it's supposed to be a success. So the first time I did IVF, I was in my mind, oh, because that time my eggs was okay. I mean, I didn't have any other medical illnesses. Yeah. So I was very positive. I mean, I was very hopeful. So when it failed the first time, okay, then never mind. Then we tried the second time, and then apparently the second time the embryo was even much more better quality. So the hope is much more higher. Then it failed again. So that time we had to we reset back everything. We go through. I mean, then we basically we tried whatever that we could do to try to be positive in the journey, and also try to have a positive pregnancy. So
Question for Ms. Ling. From TCM point of view, why do a repeated IVF failure usually happen?
Of course, this can related to your body condition, like your body is not balanced. We say in and yang should be balanced, so it can relate to the kidney deficiency, blood circulation not good, or the energy level is low.
So for Miss, at that stage, why did you decided to try TCM?
Why I decided to try TCM? Because I think, I mean, although I am from medical personnel, but I am not against TCM. For me, we have to go concurrently. Scientifically, we try to go whatever is there based on the evidence base for the fertility part. But at the same time, because I looked through when I was waiting every time for my turn, I would read the all these trials, not the trials, they have done studies, what they have posted it on the at the fertility. So I know so some people might be a bit skeptical about it, but for me, this time it's one of the game changer. This is the different thing that I did this time was I was very compliant to the acupuncture and also the herbs, because the initial time they did give me the herb at the previous acupuncture place, but I don't like it because of course it's not nice.
Yeah.
but I had to take it. So yeah, I was quite comprehensive for 12 weeks until the pregnancy was viable.
So, after trying TCM, what changes did you notice from your body?
First and foremost, I noticed that much more relaxed, calmer. Energy is better, and at the same time, my skin is much more better. I don't know it's because of I have better sleep, circulation, because they put the needles everywhere. So especially at my scalp, and then so it was the skin, because people actually noticed that my skin was much more better. I had a lot of acne before this, so it was better in that way, and you were more relaxed and not very easily agitated.
But for the skin, you feel better because we do help to nourish yin.
Mhm.
Yeah, so yin is it can make your skin looks like a bit more more firm.
Oh, okay.
For
Yes.
other, the better sleep, relax, how TCM help?
Of course, the acupuncture, it can help you to relax, and it help, especially some patients, they really like the needle,
Mhm.
because after acupuncture they can sleep better.
Mhm.
That is because that you for the blood circulation, so you can feel like a bit more relaxed, and it's related to your liver, so you feel like a bit more happy.
Yes.
So, comparing to your previous IVF before TCM and
Yeah.
after TCM, what was the difference?
I think the difference was in terms of, I think I felt a bit much more healthier. I mean, not a bit. You feel healthier. You feel positive. I mean, I think those are the things as for anybody who's doing TTC, that this is very important, because um, TTC, IVF is a journey. It's not an exam. Okay, I used to see it as something that, okay, you do IVF, you have to be, and after that you have to be have a positive pregnancy. But sometimes it doesn't go in that way. So TCM, in a way, like Ms Lin said, that it balances your emotions and then your body. So and IVF is, you have to do it as a whole. You cannot just medically you're treating it. I mean, go whatever your fertility specialist, but at the same time, other things like TCM, like acupuncture, food intake, the herbs. I think all in all, and your proper sleep. So all in all, it plays a role. So I think that's the difference that I feel before, that comparatively to the past years.
Could you share about your recent embryo transfer?
Okay, so my recent embryo transfer, actually this year, we did 2 egg pickups, because the previous egg, the embryos were already being used. So totally this year we started fresh. So January we did a oocyte pickup. That time I was very compliant to the herbs. So the egg, I mean the numbers of eggs was not very enough. So we had only 2. So but one of it, when we did the PGT, the pre-genetic testing, it came back as abnormal. So we are only left with 1. So the fertility specialist told me that we will not proceed. So we did another round of egg pickup. So that time I told myself, by hook or by crook, I have to be compliant to the herbs. I mean, it might help. I mean, we just have to be positive about it. So, I was on the herbs prior to the transfer itself. So the herbs, acupuncture, and then thankfully the embryos that we had was okay, good enough. Although we didn't have the day 6 and day 7 blastosis, so we did with the embryo day 3. We didn't do the PGT. So the difference is that although some people would actually advise on the PGT, but as what is, if actually you go through the research and from the fertility specialist, day 3 embryo also can be can survive, can survive. I mean, so I think it takes like a whole thing, but you have to be compliant, and I know it's not easy to just to come every time, and then some people don't like the needles. I mean, so I'm not so sure how it's being done for those who doesn't like needles, but for me, thankfully, I'm okay. It's not painful. I mean, I can endure the pain, and the herbs, okay, thank God it's only for 12 weeks.
So for Ms Ling, what was the area you focused on during the treatment before embryo transfer?
Before the embryo transfer. Yeah, of course, before the embryo transfer, we will focus on your uterus environment, because we know that you have like day 3 embryo, and Dr. D mentioned that the quality looks okay. I remember it's grade 1 and grade 2.
Yeah.
So the quality looks okay. So overall, we need to focus is your uterus environment. So that's related to the blood circulation, your lining thinness, and everything.
So did you continue acupuncture during your pregnancy?
Yes, I did. I just follow whatever they say. If they say I have to continue herbs, also I would continue, because I would do. I mean, like I said, from a TTC fighter point of view, you would do anything. I mean, especially if you have failed twice. I think if you ask anybody if you have to take herbs for the rest of your pregnancy, they would take. I would take it. So the just that it's the first 12 weeks was twice a week that I have to come. But since then, it's once a week. So I have never failed not to come. So I've been coming for every week. so and it's quite a nice thing, because you have someone else to talk to, and like I said, so she's like the second ONG. Like I see my fetal maternal once a month, but I'll see her every week. So she knows what's going on. She knows whatever issue that I have. So at least you have someone that you can actually share, and she can also give advice.
So how many weeks are you now?
Thankfully, alhamdulillah, I'm already at 31. Tomorrow would be 31 weeks. Yeah.
Congratulations. Okay, so what message would you like to share with those who are still TTC and considering to try IVF?
My advice to those who are trying, who has failed, or who has not embarked yet in TTC, firstly, that you have to do your homework. You have to see which center, because I wouldn't say that this center is better, this center is better. It's whichever doctors which suits you, and whichever acupuncturist suits you. I mean, the approach, like for me, I think the chemistry between me and Ms Ling is very. I mean, we just click. The first time that I met her, I think in any treatment per se that you have to have the doctors, or the treating person, and the patient itself must have the good relationship. And for the TCM per se, of course, it's an additional extra points that if you could do it, if you could endure it, is something, because there are studies which have showed that it is positive. It has positive outcome. And if you can see in all these acupuncturist room, they will have photos of everyone who has done it. Who has delivered a pregnant and positive pregnancy. So of course, I would say, just try whatever methods, extra things that you do to make it a positive pregnancy. Because it's not just medically, but sometimes, like you said, the inner, the whatever qi, yin and yang, whatever it is. But so that thing helps also. Yeah.